My name is Britton. I am a local acupuncturist here in the Upper Valley. I'm not dressed for work right now. I'm coming from coaching skiing for the Ford Sayer Nordic program and then fussing with dinner for my family. I'm kind of a tie and button down person at work. And I say this because I treat my profession with a great deal of reverence and respect. I come from a lineage of amazing teachers and scholar physicians. This medicine goes back thousands of years, and it has survived, I think, the test of time. And it's a beautiful thing to be in my position. I love my career, and I relish the opportunity to share Chinese medicine and traditionally East Asian medicine with people who are initiates and have received treatment in this lineage, and those of you who are new to it. And so bring the questions as they come to you. Nothing is too out in left field. I'll try to work everything in. It's hard to condense all of that time into an hour. And so whatever I present, just know that it's the small opinions of one mortal. And if you had someone else up here lecturing, you'd hear something else. And, you know, I've done a lot of lectures like this in my career, and to lots of physician groups and lay people alike. And I still learn from people who ask me questions, and I have to turn over these ideas and processes in my mind. So anyway, that's to say this should be interactive as much as possible. That said, I have a PowerPoint. And I chose to redo this PowerPoint with this PowerPoint template called circuits or circuitry or something like that. I was thinking, oh, it'll tie into the channel or meridian system, but I was immediately regretful that you're stuck with this. So it's kind of these like funny things. You'll see in a minute why that's so ironic. The opening slide here is a medical aphorism that, of course, sounds better in Chinese. And if you were a scholar of the language, which I'm not, there's probably a lot more to it than this. But the basic gist is, when there is blockage, there is pain. And with free flow, there is no pain. And as a clinician, my job is to facilitate flow. And if I'm not on my game doing my job, there remains stuckness and stagnation in the system. And that always is less ideal. You know, money and body is like water. It needs to move. And if it doesn't, bad things grow. And you'll see how we conceptualize anatomy and physiology as we go along here. So anyway, that's the title here. A few thousand years of traditional East Asian medicine in about an hour. I want to say that Sam introduced me correctly as a doctor of acupuncture and oriental medicine, but this was a degree that was granted like a dozen years ago, and we've since phased out that language in our profession, thank goodness. My preferred term is traditional East Asian medicine. It's much more encompassing of all of the East Asian countries and cultures that this medicine came from. But I'm sort of grandfathered into that old language. So I'm a DAOM. I went, just a very brief bio. It's so boring, but I went to Williams College. I thought I was going to be like a journalist, and then I thought I was going to be a philosopher, and then I thought I was going to go teach outdoor education for the National Outdoor Leadership Schools, and that would be my career, as being outdoors in nature all the time. And then I realized that my then girlfriend, now wife at the time, was not going to be having me gone for half the year and smelling like I had just gotten out of the woods. So I rebranded and like came into massage therapy and teaching yoga, and that very naturally led into a master's degree and a doctorate in this medicine. And currently, I'm actually in transition from a clinic that I've been with for a couple of years to now Little Green Needle Acupuncture. The building permit for the town of Lebanon just got passed hours ago, and my contractor is waiting to go. So in 2 weeks, I have a fully functioning space. Plumbing, electrical, it's all going to go great. And I look forward to maybe welcoming you there. It's really nice. I have no conflicts of interest. I'm not paid by any supplement companies or pharmaceutical companies. I'm here because I like medicine. And I'll also say I stay in my lane. If you have general questions that you want to convey over chat or in person about your personal situation, just like catch me at another time. I'm happy to answer general questions. And I try to respect my scope of practice, which is traditional East Asian medicine. So by osmosis, my wife is a medical doctor, went to Dartmouth and practices at Heater Road. And so by osmosis, I've gotten a lot of Western medicine knowledge over the years. And we have some amount of training in red flags and pink flags in Chinese medicine school, but I'm not a Western practitioner. I don't read blood labs or MRIs or anything like that. So I speak of the body and the things that go right and wrong with it in Chinese medicine terms. And I try to really respect the boundaries between me and my colleagues in that world of Western medicine. And things work out much better for the patients, I think, if I do. So here's where we're going in the next 50 minutes. Any questions that may have come in, you're going to throw them as they come in. I'm going to start with an overview of Chinese medical epistemology, anatomy, and physiology. That means how possibly did people living several thousand years ago conceptualize anatomy and physiology? How has that evolved over time? What's been translated and mistranslated into our current culture and time? And then from there, we'll go into what this practice looks like on the ground in the 21st century. And I'll speak from my own experience with that. And then we can talk about what acupuncture looks like in the upper valley on a more micro level. That's the idea. So it's another aphorism that traditional East Asian medicine is a stool with three legs. So you have acupuncture, which is what almost everybody in the United States thinks of as acupuncture. Acupuncture is acupuncture. There's needles involved. It's a bit of a minor surgery. And that's what people expect when they come for treatment. Interestingly, if you live in China, hey folks, come on in. It's just the beginning.
Okay.
Yeah.
Sorry.
It's totally okay.
I'll stay after.
Acupuncture, a stool with three legs. Acupuncture, herbal medicine, and lifestyle. So this is George Leung. He's a martial art. I hope George doesn't mind me putting his likeness up on the Howe Library screens, but he's a local martial arts teacher and is a wonderful movement teacher and mindfulness movement, martial arts. But when we say that this is a leg of the stool, it kind of encompasses, in my mind, a lot of different things. Mindful movement, that could be yoga, qigong, martial arts, Feldenkrais work, Alexander technique, it could be skiing, it could be mountain biking. What people do in the upper valley, it's more like that. Also encompasses healthy or appropriate eating and dietary guidelines. And then this is a poor sort of graphic representing your cognitive processes, which is perhaps the most important thing. Maybe you aren't what you eat, but you are what you think, and how you cognate, and how you conceptualize of yourself and your health. So there's a very old book, the oldest book on acupuncture. It's called the Neijing, and there's two books within that volume. One is the Su, and it's simple questions. The other one is the Ling Shu, or it's called the Spiritual Pivot. And the first chapter of the second book, The Spiritual Pivot, talks about the hierarchy of doctors. Like, who's the best doctor to go to, right? Like, everybody wants to know. And they say that the crudest doctor, the doctor with least skill, works with herbs, works with like substance, like they have to concoct something that you're going to drink or like imbibe, or maybe you could say inject, or whatever people are doing that's very physical. And those in that category, lots of people who use acupuncture. I think if we were practicing acupuncture 1,000 years ago, metallurgy was not what it is now, and you would have to be really sick, and you would have to want to go and get acupuncture in a major way. Right now, using sterile tiny needles, but the highest level physician, the Ling Shu says, treats the spirit. Period. Which I think is like a beautiful statement about medicine in general. That if you were looking for a truly comprehensive road to health, then you could just start there and maybe end there. The physical body is going to fall away at some point, no matter what you do to it. So, anyway, any questions coming in about that?
No, but we have one that came in.
Awesome, Mike. Fire away.
Sure.
Yeah.
So what does TCM have for circulation? So cold hands, feet, and then they mentioned Raynaud's, and this is where it does questions that recently has resulted in frostbite.
Yeah.
Okay.
It's a great question.
Okay.
And one that I'll answer circuitously after the next few slides.
Sure.
Because we're going right there. So thank you, whoever asked that question.
Okay.
Circulation, fluid circulation, and the fluids in the body, blood with a capital B in the body, is something that I think Chinese medicine has a unique lock on. There's this very wonky book by an Australian acupuncturist called Fluid Physiology and Pathology in Chinese Medicine. Man, I poured over that book for months as a master's student. And I'll just go to the next slides. You'll get it. Okay. Before I get there, I'm going to say what traditional East Asian medicine is not. Traditional East Asian medicine and the idea of qi, QI in the modern Indian, or CHI, is this idea of energy, right? So the missionaries who were in China in the early days, bringing the understanding of Chinese medicine back to Europe, came back with this understanding of qi, and it was garbled, and what are they working with? And for some amount of the population, qi is conceptualized now as this very amorphous, hard to grasp, imaginary dots on imaginary lines running on a blue thing. You've all seen like little figurines with the acupuncture dots on it. This is very likely like something that the Chinese may not have conceptualized. They were looking at the same body that you and I in Western medicine is. It has substance. And when I'm in clinic, although I am always looking to spirit and looking to the subtler aspects of what is it about embodiment so difficult sometimes, it gets in trouble. At the end of the day, like, we have this physical thing that we need to treat. So qi is not imaginary. It is very thinly. It's kind of like a photon. It's like both got a waveform and a particle aspect to it. So I won't go into too much medical anthropology, but if I could just ask you to like both let go of this, but as we get into Chinese anatomy and physiology, also imagine that you're stepping into a movie theater and you're going to temporarily, hi, welcome. You've just stepped into a movie theater and you're going to temporarily suspend your disbelief. Like, what I'm about to say about anatomy and physiology is in its own form, from a Chinese medicine perspective, completely coherent internally. But it's not imaginary lines, not imaginary dots. So I'm getting there to the Raynaud's thing. So this is how ancient Chinese scholar physicians conceptualized of the meridians and the blood and qi that flows within them. So this is an illustration for probably Gray's anatomy. And can I, if I go over here and I point, can you see? And you guys. Okay, so this text is a translation by one of my teachers, who's an MD, of this ancient book that I was talking about from 2,000 years ago, the Neijing. And in the Neijing, they lay out the channel or the pathway of the 12 major meridians in the body. And in this chapter, they're talking about the stomach, foot, yang ming channel, the stomach channel. And they say that it arises from the crossing point at the bridge of the nose near the Taiyang vessel, and it descends along the outer aspect of the nose, and it enters the upper teeth, and then it turns back and encircles the lips and descends to meet Chengji on the sauce container, where you like get, if you have like a goatee, you get stuff stuck there. And then it goes along the lower border of the cheek and it emerges at Da Ying, the great welcoming here. And then it crosses the jaw axle, or the angle of the jaw, and it ascends in front of the ear. And it passes Kejuren, and it follows the border of the hairline and it arrives at the forehead. That's 2,000 years ago. They were looking at the facial artery and its branches. That's not imaginary, and it's very real, and it's places where you put acupuncture needles to affect change. And you are changing flow of qi and blood. That's my first pass at answering the question about what was the wording of it? About
this is about circulation.
Circulation, right? So even back to I'm going to go back to the very first slide here because it's worth restating. When there is blockage, there is pain, and when there is free flow, there is no pain. So back to this. Trigeminal neuralgia, occipital headaches, facial palsies. All of these things are blockage of flow somewhere along possibly the stomach channel or any of the other channels, because they actually all meet in the head. That's where the subtlety gets in. Go to school for 6 years to learn like the details, but like it's all there, right? This is another illustration, simplified, of the stomach channel, right? Descends the outer aspect of the nose, encircles the lips, and the dots are major acupuncture points along that channel. Jaw axle, Kejuren, up here to the hairline. Very elegant. And what always gives me shivers is when I put a needle in here and someone's like, oh, wow, I feel it right up at my temple. That's not uncommon. You all have these channels, And in Western medicine, for some of them, we call them major neurovascular bundles, like the artery, the vein, and the nerve all run together in the brachial plexus down the arm. That's the lung channel. I could go on and on about the pathways of the channel, but it's pretty cool, the convergence of what the Chinese scholar physicians were looking at in the body and what we now know of as in our own nomenclature of these certain structures that are in the body. There's not an exact linkage because I don't know if the ancients were particularly interested in like every single detail, or it was like enough to feel it, right? And you have a rough pathway. So flow, I love it when people ask questions that like lead, it's like my whole lecture, that one question about what about flow? And as above, so below. As outside, so inside. These are what the Chinese medicine physicians say. If you can see it in nature, it's happening in you. So just like the Connecticut River is a major channel or pathway in the body, so it is fed by Mink Brook and Grant Brook and all the other tributaries coming into the major channel. And branching out from that are springs, little waterways, snowpacks. And in addition, like all of the soil and the milieu that constitutes an ecosystem. So in you, that's the major fluid channels, the major arteries, the major vessels, the major nerves, and then all of the ground substance, the interstitial in between the cells, like all of the stuff that makes up the supporting tissues that promote that flow or inhibit it. And a couple more visuals for you. I don't really have a lot of like text in these slides because I'm over that. It's like boring to talk through a slide, right? So this is one of my photographs of our lovely Connecticut River, and this is probably somewhere in the Amazon, but it's clear what I'm getting at, right? It looks like it inside and it looks like it outside, and then I have this amazing etching of a human placenta when my first daughter was born, and I saw her placenta. I was just blown. It was like, oh, that's the greatest illustration of the channel system I've ever seen. And this is like what it is, the umbilicus, and then this life-giving thing that sustains an embryo and all the branching things that go out from it. Mind-boggling. Any questions coming? Any questions here?
How'd you take that picture? Hey,
I grabbed that off. It's a screen grab off the internet.
oh, okay, it's not your own daughter.
No,
Oh,
I did take pictures of that, but they're personal and I'm keeping it for myself.
well, my son has saved the placenta from both of his daughters.
Yeah,
To formaldehyde or something. So.
There's a lot to say about placentas, right? It's the only meat that comes from life.
Yeah.
The only what?
The only meat that comes from life. Like it's grown and
Yeah.
and yeah. I went to school in Portland, Oregon. And I went to school at the National University of Natural Medicine. There was a whole naturopathic medical side, medical school side of things, Chinese medicine school, naturopathic medicine school. There was a good amount of people having babies at that school, and there were a lot of people drying, granulating, and eating placenta. New Englanders are a little bit more in the box, but in Oregon.
I think this need facials with like placenta tissue or something.
Oh, I'm sure it's on TikTok if it's
Yeah.
happening now. The new slugging or Vaseline things. Yeah. And any other? Yeah, please.
Well, when you're asking the floor for questions, what do you mean?
Oh,
Like, can you tell me the channels, what might relieve my need, like specific,
oh,
or
good.
do you mean generic?
Great. I'll back up and say, I need to, in just for, I would, if you would like to talk about your specific concern, I'm happy to see you as a patient, but I try to keep these lectures like a little bit more meta.
Sure.
And as I go, or at the end of this lecture, I hope for you to be able to answer some of your own medical questions. Maybe not put a needle in your own knee, but like at least have a concept of why your knee is symptomatic. Or,
I
yeah.
probably know why.
Yeah.
Pretty well, but okay. So can you speak to how would I say it? do you see, have you observed, side to side? Like, is there a tendency, could there be a tendency to have ailments or dis-ease maybe on one side more than another? And is that a misalignment or a blockage? Or is that
Yes.
unusual? Is that common?
No, that I've never met anybody who was like the same sides. Like everybody has something going on, and we have lifelong biomechanical patterns that set us up for sacroiliac joint pain on one side, a shoulder that's gotten overused. I mean, on the most extreme examples, if you take like a pitcher in baseball, right, like everything's going to be loading on one side. But all of us have habit patterns that create imbalance. Even if you're one hand dominant, you notice the other hand is usually just stuck and static, holding the phone. Oh, this hand's doing a lot, but this arm is doing nothing. I've had patients self-diagnose as iPhone holding itis or something like that, just because this arm does not move. And it's like your eyes start to go at a certain age and you're like having to hold it out here. And this arm goes numb, right? Like the fingers go numb.
Yeah.
But this hand is fine because it's doing all this stuff, pouring the juice or.
So it sounds like you're intimating there could be a lifelong thing, because if you're dominant right hand, that's your whole life. But if you have like something is presented on one side,
Mhm.
and then years later you start to have other things on that same side, is there potentially a connection, or is it just sort of like
Absolutely.
random kind
So
of?
on a very basic level, nothing is irrelevant in Chinese medicine. Like I practice medicine with like time and direction. So we are all set up from the minute you are born and you lose what we call the prenatal chi. Like you're getting everything from your mom for 9 months, right? The minute that umbilicus is cut, you're dependent on your environment for nutrition, for sustenance, for your basic life forces. And immediately after you come out, you're subject to whatever is in store for you. And so, now we know the prenatal environments and even your grandmother's experience as she was gestating your mom has an effect on your flowering. So that's like as a person, right? So nothing is irrelevant. What you experienced, as a kid when you went to kick the soccer ball and you hit the tip of your big toe instead of the laces of the boot and you broke your toe or you injured your toe, that could set you up for a lifelong of weird S-curve patterns that left knee, right toe, left knee, right shoulder, neck, there could be anything. You're a little hard of hearing in one ear, so you're constantly turning your head to the good ear so people can speak to you. It's common.
You sleep on your side.
You sleep on one side.
So the other shoulder starts to be.
Either the crushed shoulder gets impeded by flow.
Right.
Right.
Yeah.
Right.
Interesting.
Yeah, it is interesting.
So is the lymph tied, the lymph system, when you were talking about this,
Yeah.
a lot, the circulatory, that sort of overlays, or that's directly, like if you've had lymph nodes removed?
Yeah.
That's a blockage?
Correct. Right?
Yeah.
It's a channel that was once patent that was removed. The wonderful thing is that your body is great at collateralizing, right? Like the body finds a way. Humanity, like your organism finds a way to keep going. And so the repair mechanisms and the movement back towards equilibrium is incredible. The healing power is unreal. Like it really is, especially in kids, right? As you get older, it takes a little bit longer. But we all have it until our last breath. So, the human body can sustain a lot of trauma. It's remarkable. But it does present challenges. And my job, and we'll get to this, my job is to diagnose where's the blockage, how do you restore flow? Or if there's too much flow, how do you tamp it down or redirect it. Temper it. Try not to do a lot of tamping. Really good, very interesting, good questions. Please. I'm kind of non-linear in my thinking, and I mean, I do have this sort of like, I enjoy it occasionally, like just going straight ahead, but I'd much prefer to meander. Oh boy, did we go through all that? Yeah, that was it. That was Chinese anatomy and physiology.
What was that last one? That was the cross or the T? Angelique something.
Oh, yeah, no, I'm getting to that, right?
Okay.
So we'll put it in practice now.
Okay.
In a bit like you asked me about your knee. Okay, so well, let me go back and say a little bit more. Okay, as outside, so inside. As above, so below. You have this ecosystem, right? In your body, if the ecosystem is nourished and the right temperature and if the milieu is great, that is not an environment where disease can arise, right? It is just a pristine environment, and nothing can take root there. There's like an old story about a debate. Pasteur had a contemporary. I can't remember his name right now, but they were locked in a battle, and Pasteur was always advocating for the cellular origin of disease, right? Like, your one cell is going to go haywire, and the other was saying like, no, it's actually like the environment that creates the correct conditions in which a cell will not be healthy, right? And Pasteur one. So we're left with cellular disease models. But I believe in that, but I also believe that the environment is very, very important. So my job in clinic is to take Angelique, right, not a real patient, and to sort of plot Angelique's internal landscape. And Angelique comes in to clinic. She's constipated. She can't really see this. She's thirsty all the time. She's constantly getting UTIs. Like the urination feels like literally hot and burny. And like she's hot-headed, emotionally labile, right? Those are a few symptoms. And then additionally, constitutionally, she's tall and thin. When she has her menses, they clot. When I feel her pulse, which is a form of diagnosis, it's very fast, rapid. And she's got a red tongue with this dark yellow coat. She's been drinking and enjoys whiskey. And she's a 3-season athlete and exercises in all of her free time. And I don't know if any of these symptoms, like, would you be able to play this game? That I would plot her as hot and dry? Like, what happens when you get constipated? Your stools don't have enough fluid in them, right? It's hard for them to move. You're thirsty all the time, like your fluids are drying out. Your urination is going to become hard. It's going to feel actually hot. And then emotionally labile, hot-headedness, sure. Tall, thin constitution, like things are just evaporating off of her. Any fluid in the body that you can see in Chinese medicine is very useful because we come from a time before blood draws and ultrasound. So the condition of the menses are really important for us to look at. And if something is congealed and dried out in the menstrual blood, that's a finding. That's interesting. And I would put that as dry and hot. And then the pulse being fast, well, when things get warm, they speed up. The red tongue with the yellow coat, it's a sign. And then whiskey and alcohol generally has a hot nature, so you're just fueling the fire. And then if you're exercising all the time, you're just burning up all of the fluids that you don't have a lot of. That makes sense? Yeah. Yeah.
Well, could she be drinking enough water to, like, say, for the exercise? Does it necessarily those two go hand in hand?
Yes.
Or she were hydrating?
And if you look at like the Mojave Desert and like it's a cracked ground landscape and there's a dump of rain, what happens to that brain? Does it penetrate into
No.
the soil? No, it runs off and it's like goes into where they've been like putting too much phosphorus and fertilizer in. Like you get a huge algae bloom. It's a disaster. So the answer is both. Like, yes, you can rehydrate, Angelique, possibly, but are you getting that hydration to the right place at the right time and to a receptive environment? You're like, yes, right? Yes. Chinese medicine is not that complicated.
Yeah.
That's Utah, and it's pretty right many years ago. That's that internal landscape, right? Danny, on the other hand, his stools are loose and watery, right? Like he eats any amount of dairy, it's just not a good scene. After eating, he feels tired and he's fatigued and he's bloated. Nothing is being transformed in his digestive system, right? It's like going in there, room temp, and it's sitting there. There's no furnace to burn and transform that food into usable energy. No sex drive, and he's got brain fog all the time. Just feels clouded, feels like cotton wool in his head. His body temp is kind of heavy. The pulse is really slow. And then when I look at his tongue, it's literally swollen like a sponge, been sitting in the sink too long. And the coat is greasy and gray.
That was a big tongue.
That
was like cow size.
Yeah, you should see what I've seen. It's like, yeah, for sometimes every once in a while you get a real, oh, I'll put that in the notes. And then he's kind of sedentary, like doesn't really move his body, doesn't move his chi, he doesn't move his blood, and he overeats. It's like adding more stagnation to the system. So I'm plotting damp and cold. Okay. So for those of you who are here and for those of you who are watching on Zoom, give me some foods or spices that will help Danny, his internal landscape. Sam and Mike, you guys are on the hot seat too. Peppermint. Great.
Cinnamon,
Cinnamon. Keep going.
clove.
Clove. Oh. Done. We don't have to go any further, right? Like it's like what? Turmeric. So good. Just pipe right in.
Okay.
Turmeric, cinnamon, clove, ginger, cardamom.
Ginger.
These are things that do they have calories? No. Do they have minerals? No. What is it about a spice that gives you the sense that it's warming and drying and is going to pull Danny from his damp, cold state into balance? What is it about those herbs?
The way they smell.
Oh, it's the way they smell. Yeah, smell is like this incredibly primal system, right? It's like the only nerve, or the olfactory system, the only nerve goes straight to your deepest brain processing centers, right? So when you smell an orange peel, like you peel an orange, oh God, that brightens my day, right? Or a lemon or cinnamon. We just know those are warming, right? That is Chinese medicine right there. It's not a substance that's going to. There was this like craze about resveratrols for anti-cancer effect, right? Resveratrols you find in the peel of grapes, and they're in red wines and stuff like that. 10 years ago, there was like, they found resveratrols. There's a substance that's like antioxidant, great, super. You would have to literally have a tanker full of red wine to get the amount of resveratrols to gobble up all of the free radicals in your body. Nobody is drinking red wine like that. But what is it about red wine that was somehow protective because of those resveratrols? Resveratrols likely like incite in your system some change, environmental change. Just like when you imbibe cinnamon, you are not shoveling warmth into your body. You're not shoveling dryness into your body, but somehow it dries you out, warms you up. That's why it's pumpkin spice season in the fall. Everybody likes that. It feels like, oh, it's warming. You like pumpkin spice now. It's like it goes crazy in the fall. Everybody wants a little hit of summer or something.
This isn't a question.
Yeah.
It's a comment.
Yeah,
So
go.
somebody says, I hope I'm pronouncing this right.
Yeah.
That this is paralleling Ayurvedic medicine.
And it does because, and again, like I'm not a medical anthropologist, but in my master's program, you get a good dose of where this medicine comes from. And in the Qing dynasty, in the roughly 200 before the Common Era to 200 after the Common, there was time of tremendous upheaval in China and in that region. And as happens when there's lots of war and chaos, populations were moving around all the time. And they were definitely going back and forth between India, and scholars and physicians were going back and forth to India and sharing information with the development of, Ayurvedic medicine was happening at that time. And it's been a constant flow since then. Silk Road, like you could look back and read a whole bunch of wonky Paul Henschel books about this. And it's very fascinating, but yes, in Ayurvedic medicine, and I taught yoga for a dozen years before going back to school for Chinese medicine. So the Nadi system is a system that looks a lot like the channel system or the meridian system. And some of the same herbs are used, but the nomenclature is a little bit different and the concepts are very much the same. Just like our circuits PowerPoint motif. Okay, anyway, that's Danny's internal landscape. It's like swamp. About a month from now, everything's going to look like that in the Upper Valley. The peeper frogs will come out. Oh, that's good. Okay. Okay, so that's what traditional East Asian medicine kind of looks like when I go to clinic in the morning. And because of that big meta picture, because I'm always plotting people on this like hot, dry, damp, cold, further reduced to yin and yang, like is someone abundant in yang or abundant in yin or deficient in yang or deficient in yin. As a Chinese medicine practitioner, I can treat anything let me back up. I can take a reasonable guess as for a diagnosis and treatment plan for anybody with anything that walks into my office. It's a very weird thing to think about, especially for my wife, who's a pediatric dermatologist. It's like rarefied air because she goes to school for so many years and does fellowships in this one part of medicine. And it's really weird to think that I could see any amount of pathophysiology and say, oh, I think I can plot that. I think I can think about that in terms of yin and yang. And the caveat is that I can't always adjust the curve the way I'd like. Sometimes I get great symptom relief. Sometimes I don't. Sometimes I treat subsidiary concerns pretty well, but the chief concern doesn't get treated. And folks that came in a little bit later, like one of my first slides was that I stay in my lane because I feel incredibly blessed and I'm in a luxurious position to not have to save people's lives in this day and age. I just don't, right? Like I lean on my colleagues at Dartmouth and in our community practices all the time. I'm also a medical pragmatist because Chinese herbs are expensive. They come from a long way away. And ibuprofen is cheap and readily available and has its place. Okay. Anything from what I've covered? Questions, comments?
You might want to do this at the end or something. But this comment is that they're interested in your ideas about how traditional East Asian medicine ties into martial arts.
Oh, so good.
I think they may have read your bio.
Okay. Yeah. Well, thank you for the question.
Yeah.
I assume everybody can hear
Yep.
because of these green dots.
Yep.
Okay. Martial arts and Chinese medicine came up in complete synchrony because if you're in an agrarian or martial society, you have to have medicine to treat the injuries that come from that part of your culture. So people are always getting injured. And so Chinese medicine traumatology is incredible. And I practiced martial arts pretty intensively when I was a kid growing up. But also when I was in school for 6 years out in Portland, we had it was a very intense school of martial arts that I trained with. And people were always getting injured and then people were always treating each other with medicine. It was great. So they're completely related. And now most people break something and they go to the hospital, get x-rays and a cast, but Chinese medicine can treat major trauma as well. I've seen it. It's cool. I don't really do it in my practice, but if whoever asks the question wants to follow up or ask for more specifics, I'm happy to go, but that's the general answer. Yeah. Okay, so we've covered bullet points 1, 2, and 3. And then I am happy to talk about what this looks like in our community, if you want to talk about that, or anything else you want to talk about. I have another slide that's very dazzling. We can go there. That's the most text I've put up, and there's quadrants, more quadrants, and also circles. Should we go? Yeah? Okay. So this part of the lecture is about how do we know what acupuncture does in today's scientific paradigm that we live in, right? Because there's an amount of this that is total gobbledygook to most people who have never heard a lecture about it, or what is qi? What is blood? Well, from my perspective, it's qi and blood. And as I've said, it's completely internally coherent. But if you are a Western physician or a researcher, you want to be able to find out, is this medicine helping people? Are there risks? What is the risk benefit ratio? What specific conditions does it treat best? What kind of people respond to it best? So for the last 30 years, there have been a lot of research groups, and our government has been tearing into Chinese medicine and trying to figure out answers to those questions. And about 20 years ago, the Society for Acupuncture Research, which is a group of acupuncturists, physicians, and researchers, wrote a white paper that shaped how acupuncture research has gone in this country. And so, and I'm saying all this because it's at this point, only some people have access to Chinese medicine and acupuncture, right? It's it's not universally covered by Medicare, Medicaid. It's not universally covered by commercial insurances. A lot of people have to pay out of pocket to go and treat. How do you know if your money and time spent is going to end in results? So here's what was posited is how this medicine is working. On the top part of this, top 2 quadrants, you have parts of Chinese medicine that have nothing to do with needling, nothing to do with the procedure, with the minor surgery that is acupuncture. On the bottom half, you have things that have to do particularly with the needle technique. On the left side of the graph, you have parts of acupuncture that are not specific to Chinese medicine. These things go for any form of medicine. On the right side, you have things that are specific to Chinese medicine. So, are you with me so far?
Is that just red part, not the outer part?
I'll get into that.
Okay.
So here you have on this quadrant, not specific, having nothing to do with needling components of what Chinese medicine does. That is the fact that you've come to my office and I'm giving you my attention. I'm hopefully empathizing with what your situation is, and I'm giving you my time. And you have invested in all of that as well. And that is healing across the board, whether you go see me, another acupuncturist, your PCP at APD, any practitioner of any sort of medicine doing any sort of decent medicine is healing, doing healing work. They're working in this quadrant. It's not specific to any particular kind of medicine, and it's not specific to Chinese medicine, right? It should be a healing event to go to a doctor. That's a very old relationship, doctor-patient. However, when you come and see me, I am giving you another point of view to conceptualize of your health concerns. And hopefully also reminding you that as well as the symptom that you're experiencing or the condition that you've been diagnosed with, you have a whole lot of you that works really well and that is always working towards equilibrium and balance. And I'm giving you that because I'm giving you a minor lecture, like I've just done for the last 45 minutes, on like, oh, this is what I'm feeling. I'm feeling high here. I'm feeling cold here. I'm feeling stuckness here. I'm feeling good flow here. I'm feeling like maybe we could talk about your emotions or your relationship with your kid. Do you want to think about a mold testing in your head? You know, it's like, what's the whole thing that I'm thinking about? I'm thinking of you as an entire organism made up of all that's happened to you in your life and your entire environment. That's pretty cool. That's personalized medicine. And Chinese medicine has been practiced like that for a long time. But it doesn't have anything to do with acupuncture. It's not specific to needles. Down here, you have the fact that I'm going to put a needle in you, or not, because I treat a lot of people who are very needle phobic, and I never do insert a needle on them. I just do moxibustion or manual therapy with my hands or cupping or whatever it is. But these results that happen from sticking a needle in someone confused early acupuncture researchers terribly. Because what was happening is that you were doing true acupuncture on patient A, and in a randomized control trial, you were doing fake acupuncture, sham acupuncture on patient B. And it turns out that when you break someone's skin barrier, no matter with what kind of implement or where you're sticking the needle, there's a whole bunch of stuff that happens internally that can be healing. They used to do sham surgeries on people's knees where they would like take two people with osteoarthritis of the knee and they would cut open patient A's knee and actually clean it up and do stuff. Patient B would get cut open and then just get closed up again. And they'd see who did better. That is not ethical. That is not done anymore. But it is a part of like how you figure out if a procedure works, right? So early acupuncture research, they would do sham acupuncture, they would stick a random needle in anywhere, and then they would do real acupuncture. And it was like, wow, both seemed to be really helpful. And then there were some years where it was very depressing for people who had spent a lot of money on school tuition, gone to school for a long time, because it seemed like a monkey could stick a needle in you and get good results. Super placebo results, in fact, which is, when I'm having a bad day, I just lean on that. I'm like, wow, man, I have this tool that's going to be helpful to a super placebo effect. That means like quite a good percentage of people are going to respond just because I've approached them with a needle and maybe done it sort of acupuncture. However, when they started comparative research on acupuncture as it's practiced by licensed acupuncturists with a lot of training, and then on sham acupuncture, you start to see a real divergence in effect. So that was a relief. But anyway, it turns out conservative acupuncture helps, no matter if you're skilled or not skilled. But then there's 1,500 hours of clinical education, which has to do with exactly where you're finding the acupuncture point. Where is the blockage? How far are you sticking the needle? What size needle you're using? So on and so forth. What's the stimulation you're doing? So there's nuance in how you practice acupuncture. So after all this, research has gotten really good, and we're at the point now in our profession and in in the field where Medicare is going to start covering acupuncture for certain conditions. And, there's wide recognition that acupuncture is very effective, very safe, very few side effects. It's kind of a beautiful age or era for Chinese medicine. It's one of the reasons why I love practice, because I get referrals all the time from people who seem to trust in this medicine. So, did I demystify that slide well enough? In the Upper Valley, there are, just like any other community, there's an array of practitioners with all kinds of different training and backgrounds. And we're all kind of good at different things. There's a wonderful practitioner in Clichy who just focuses on women's health and menopause to menarche type stuff. There's people who love to do musculoskeletal orthopedic style treatments with tennis elbow and lower back pain. People love GI. Other people love gastrointestinal IBS issues. I mean, it runs the gamut. And in the Upper Valley, like in every other field in the Upper Valley, like we're short on acupuncturists. So, we need more people practicing this medicine. We'll make it more accessible for all who need it. And I think lots of people can benefit from this. I think I'm kind of, yeah, that's it.
Is that your business, Little Green Needle?
As of today.
Congratulations.
Thanks. Yeah, I was at Open Door for about 10 years in White River Junction with my colleague Kate Campbell, and I ran a nice little crew of acupuncturists there. And then the last couple of years I've been with a colleague in Lebanon, Mitya Shapi, and she had to leave town for the better part of the year. So I'm now striking out back in solo practice, which is like a little bit sad, but
Exciting still.
it's exciting. You got to.
So would you refer someone?
Yeah.
Would you, you mentioned there's specialties within your specialty.
Yeah.
Would you refer someone, like someone came to you and you weren't,
Always.
maybe you were getting symptom relief, but not the problem being
Yeah.
resolved?
Yep.
Do you refer to other practitioners?
100%.
Yeah.
I would feel way too much pressure to be good at treating everything.
Yeah.
And I'm of the firm belief that for every problem, there's a key somewhere out there and there's a practitioner somewhere out there. So a lot of my first visits with people involve like generating a list of referrals actually for other kinds of practitioners other than me. I love team medicine, like not traditional East Asian medicine. I love traditional East Asian, but literally like, so we all need to be wrapped up by a community of care. And that definitely includes PCPs who are like overworked and under-resourced. Yeah.
So I was late and I missed your little introduction. Do
Yeah.
you have a specialty or what is your,
Do I have a specialty?
or are you
Um,
general or what?
I'm general.
Okay.
I'm general. I really do love treating everything. Like
Like
that's
what
big.
kind of things, like this is all new to me. I just saw it in the paper. I'm like, all right, we're going.
Yeah.
I'll learn. I'm like,
Thanks for coming.
but so like what kind of things? I mean, just,
Well, 100% of my patients, including me, deal with anxiety.
okay.
Right? That's the modern condition. So pretty much everybody I help with anxiety to some extent.
Okay.
And then if you branch out from that, insomnia, irritable bowel, GI symptoms, tension headaches,
Okay.
But
are you-
high blood pressure.
Yeah.
But here's where I don't treat high blood pressure.
Mhm. Yeah.
Lisinopril treats high blood pressure really well, really cheaply. I help in high blood pressure, the chi and blood are getting stuck, rising up and coming too forcefully to the surface. So I help people ground and center their chi and blood. And then the blood pressure usually comes down a few points. That's called, anchoring yang or anchoring an anchoring treatment.
And what was that? I don't know if it was called a book, but that you mentioned,
Yeah, the,
like
the
from,
Neijing from 2015.
yeah, how do you spell that?
Neiging.
Okay.
So it is
Yep.
the internal, there are 1,000 translations of that. The Yellow Emperor's Canon of Internal Medicine. Jing means, Jing means various things. So every character in Chinese medicine has like lots of different meanings through time. But this Jing means the when you're weaving on the loom, it's like the real threads that you weave all the smaller ones around.
Okay.
So Jing refers to the books in ancient cultural China that are the underpinnings of that culture. So there's the Neijing, which is the Yellow Emperor's Canon of Medicine, which is the Jing of medicine.
Okay.
It's the central thread of medicine on which that lineage of medicine is built. But there's all kinds of, there's like Jing of everything, Jing of government, Jing of this thing. But that's the Neijing. It's not a very good read if you don't speak ancient Chinese, and I've tried for years. But once you dig into any one of those characters, there are like 150, 200 characters in that whole book, and you can go down rabbit holes. And like, I think, well, this is a tangent, but I think if you really do understand the culture and language, you understand the medicine better and you're a better clinician. So I gave it a real college effort. Yeah. What else? Anything? No? Yeah. I love talking about Chinese medicine. So if there are questions after, I'm happy to stick around.
So do you do acupuncture, but do you do?
Yeah. What do I do?
Yeah, what do you do?
Yeah, what do I do? I do acupuncture on most people because most people come for acupuncture, and I use you're aware, I use the smallest, thinnest needles that modern metallurgy allows. They're a 44 gauge needle, and the way that acupuncture needles are designed, they're kind of a tapering edge, and it gently parts the tissue, and you barely feel it, and they're
You
little
didn't bring
green.
any for us to see?
I
No.
didn't. I should have. I wonder if I have some.
Ask for guinea pigs.
Yes, they're little and they're green, so the handle is green. And then almost every treatment that I do, I pair with moxibustion, which is I don't think I have a picture of it. Moxa is a warming technique that uses Artemisia vulgaris. It's a mugwort.
You gardener.
Oh, Artemisia grows around here.
Yeah.
This is the kind that I use for in the highlands of Japan. It's very refined and it's dried and it's sifted. It's like all impurities out. And I take little threads, little rice grain size, and sometimes, well, pretty much for lots of treatments, I'll do a little few cones or a few rice grains of moxa lit directly on the acupuncture points where the needle has gone in. And do I have time to go for another couple minutes?
Sure.
All right, you're hanging in.
Did you say lit like with a match?
Lit with a match.
Okay.
So qi and yin and yang. Yin and yang, I'm trying to balance yin and yang in all of my patients. In the body, yin looks like blood and yang looks like qi. So the needles go and deal with the qi mainly. You could think of that as like the needle goes into that neurovascular bundle and it stimulates some nervous system energy, right? You can't touch nervous system energy though, right? It's instantaneous. You can't like hold it. It's like electricity in a wire, right? The needles do great at literally breaking up blockage in the system. There's an ice dam in the river. You go in and you hack it with the piton, and it breaks up, flows back in that system of qi. But what happens with the blood, the substance? Blood, especially with aging, with cold weather, with injury where you've torn a whole bunch of stuff and the blood's not getting in there, you have to motivate and warm the blood. And Artemisia vulgaris, mugwort, is the preeminent herb for warming and motivating blood. So I've got the acupuncture needles, which rectify the qi flow, and then I go in with the moxa, and I literally warm and motivate or regulate the blood. It's a yin and yang balancing
that?
treatment.
Like a second or just a
If
drip?
you're
or-
watching it, it's so boring. I take a little piece of incense.
Yeah.
The little rice grain sticks up out of the acupuncture point.
Yeah.
There's not a hole there, it just sits on the
Yeah.
skin. And I light the tip with and it becomes an ember.
Yeah.
And it burns down, and I use a bamboo tube or my fingers to modify the amount of heat that I'm introducing into the acupuncture point. So I don't like blister people, but that's done in China. But you just feel like, right? What is cinnamon? What is clove? What does it do if you introduce heat to an acupuncture point that the person can feel a little bit, but not painful? And what happens is, on these points on the back, for instance, you put the needle in, leave for 15 minutes, pull the needle out, put the mox on, do a wonderful treatment where it's like a zigzag of heat down the back. And then there's a glow, literally the skin, like a wave of warmth and pinkness coming up into these acupuncture points. It's very cool. I should have taken, I don't know, they'll refine the slide in at some point. But that is working on, from a Western perspective, the dorsal root ganglia coming out of the spinal column, innervating the central organs of the body, the lung, the heart, the liver, the intestines, the stomach, the spleen. Because each of those dorsal root ganglia that we call the back transport points go to a specific function in your body. And if someone's got IBS because their system is damp and cold, I definitely want to adjust the qi and blood going through those back transport points for the dorsal root ganglia. I want to get their digestive system a little fire, a little movement. It's so radical. It's so cool.
Well, I find this very fast. Are you doing a follow-up or do you have any classes or like?
You just got the whole thing. It's not more complicated than that. I mean, people are not just hot and cold or damp and dry. Like there's mix. Like you're a bunch of. It's a messy thing to be embodied, to have his body, but it's like that's what I do all day. But I lecture physician groups and I give
But I
grand
think,
rounds
I
occasionally.
think it would be interesting to, like, you said you aren't just an acupuncture person. You want people to be surrounded by a whole network of, I don't know, maybe a massage therapist
Yeah.
or a, hydro
Reiki.
splashing
Yeah.
person or something, what I
there's
mean? Like,
always
so it's like,
yeah.
I would like
You would love that,
to
right?
learn more, like,
How they can.
I just find it very fascinating.
Oh, it's the best. And there's, through the Howe or plug the Howe. I bet you guys are occasionally having lectures like that. I hope, but Osher might have it. You can find it.
Yeah.
When I was at Open Door for all those years, we had like quarterly grand rounds where we'd have community presentations, and that was a really integrative center. We had lots of people, but all things have a cycle, and like it ended. And occasionally in the Upper Valley, people have these ideas. There's a doc named Rusfeld who tried to turn Dartmouth Hitchcock Lyme. It was like an integrative medicine center for a while. There are a few docs at Dartmouth who have been tirelessly working to get this going within the Dartmouth system, but we have a slow-moving community in that way. If you're in Boston or LA, any of the hospitals have integrative medicine. Cleveland Clinic, Mayo, it's all like right there with lots of education, but we don't have it yet here. But slowly over time. But the information's available out there, and whether or not, thanks for your interest, it's great, but whether or not you sort of you can experience all this inside your body by just getting into it. Either through acupuncture, or you go to yoga class, or find an Alexander technique around here, teacher, qigong, George Leung, Tai Chi. There's so many ways to balance yin and yang, to restore chi and blood flow, and just like feel better. This is just one method.
Does that make blood
No,
when you pull the needle out? It's not so it's not going.
one in 500 needles I'll pull out, there'll be a little bit of blood. Occasionally a nicotine or something like that, and that's both of them. Yeah, it's great, and I've worked with people with hemophilia and on blood thinners, and like I said, the needle tapers and it parts the tissue as it goes in.
Hmm.
A hypodermic needle is beveled and it's hollow and it's meant to be a cutting edge because it has to inject something, but this is a different procedure altogether. It is surgery on the channels and collaterals, and it is working into a different space in your anatomy.
Thank
Yeah.
you so much.
Thank you. Thanks for inviting me.